Welcome to this presentation. In this presentation, I'm gonna speak about ventilators. When a patient is incapable of adequate ventilation by natural process, mechanical assistance must be provided so that sufficient oxygen is delivered to the organs and tissues of the body. And excessive levels of carbon dioxide are not permitted to accumulate. The procedures and instrumentation involved in providing mechanical assistance in respiration and in supplying hypoxic patients with higher than normal concentration of oxygen and other gases or medicines constitute a field known as respiration therapy. Until the past few years, this field was known as inhalation therapy, but since it covers much more than inhalation, the more encompassing term is preferred. Instruments for respiratory therapy include such devices as inhalators, ventilators, respirators, and positive pressure breathing apparatus, humidifiers, and nebulizers. Many of these instruments, however, have overlapping functions, and the name used for a particular device may vary among manufacturers. And the ventilators are used to improve the ventilation of the lungs to supply humidity or aerosol medications to the pulmonary tree continuously or intermittently. And the modes of operations are Asus Mode, Control Mode, and Assist Control Mode. The terms ventilator and respirator are used interchangeably to describe the equipment that may be employed continuously or intermittently to improve ventilation of the lungs and to supply humidity or aerosol medications. Most ventilators in clinical settings use positive pressure during inhalation to inflate the lungs with various gases or mixture of gases. Expiration is usually passive, and although under certain conditions pressure may be applied during expiratory phase. And most respirators in common use are classified as the following categories and can be operated in any one of these three modes. These modes differ in the method by which inspiration is initiated. In the Asus mode, inspiration is triggered by the patient. A pressure sensor responds to the slight negative pressure that occurs each time that the patient attempts to inhale and triggers the apparatus to begin inflating the lungs. Thus, the respirator helps the patient inspire when he wants to breathe. A sensitivity adjustment is provided to select the amount of patient effort required to trigger the machine. The Asus mode is used for patients who are able to control their breathing but are unable to inhale a sufficient amount of air without assistance or whom breathing requires too much effort. And in the control mode, breathing is controlled by a timer set to provide the desired respiration rate. Controlled ventilators is required for patients who are unable to breathe on their own. In this mode, the respirator has complete control over the patient's respiration and doesn't respond to any respiratory effort on the part of the patient. In the Assist Control mode, the apparatus is normally triggered by the patient's attempts to breathe as in the Assist mode. But however, if the patient fails to breathe within a predetermined time, a timer automatically triggers the device to inflate the lungs. Thus, the patient controls his own breathing as long as he can, but he could so fail to do so, the machine is able to take over him. This mode is most frequently used in critical care settings. In addition to the three modes described, many respiration can be triggered manually by means of control on the panel. Once the inspiration has been triggered, inflation of the lungs continues until one of the following conditions occurs. And the delivered gas reaches a predetermined pressure in the proximal or upper airways. A ventilator that operates primarily in this manner is said to be pressure cycled. A predetermined volume of the gas has been delivered to the patient. This is the primary mode of operation, that is volume cycled ventilators. That is pressure cycled, volume cycled, and then the air or oxygen that has been applied for a predetermined period of time. This is the characteristics mode of the operation for time cycled ventilators. And the various types of ventilators in clinical use can be categorized by two basic types. And the first is pressure cycled, positive pressure assisted control. And the device is powered automatically from a source of gas and requires no electric power. That is in pressure assist control. Devices in this category may contain An electrically powered compressor or can be used with a separate compressor to permit ventilation with ambient air. And in this method, it includes all the necessary equipment to control the flow of gas, mix air and oxygen, and sends the patient's effort to inspire, terminate the inspiration when the desired pressure is reached, permit adjustment of the sensitivity of the triggering mechanism and the desired pressure level, and even generate a negative pressure to assist expiration on some devices. And a special type of valve that incorporates a magnet senses the small negative pressure created by the patient when he attempts to inhale. Timing for the operation is controlled mode is accomplished by filling a chamber with gas and letting it bleed off through an adjustable needle valve. So in the prescribed time, the pressure drops to a level at which a spring-loaded valve can operate. One highly used respirator in this category includes 3 pneumatic timing devices of somewhat different type to provide time cycling as well as pressure of cycling. In the volume controlled ventilators, it uses either a piston or bellows to dispense a precisely controlled volume for each breath. In the critical care setting, where patients have pulmonary abnormalities and require predictable volumes and concentration of gas, this type of ventilator is preferred. It is much larger than pneumatically operated units, and most units stand on the floor besides the patient's bed. So this diagram shows the volume cycled ventilator. Volume respirators are electrically operated and provide a much greater degree of control over the ventilation than the pressure cycled types. Most devices of this type have adjustable pressure units and alarms for safety. Volume cycled ventilators used in critical patient care are always supplied with a spirometer to permit accurate monitoring of the patient's ventilation. A form of volume controlled respiration is possible with a type of pneumatically operated respirator that permits time cycling. This flexibility is based on the premise that a given amount of airflow for a specified time duration results in a controlled volume. Other available features include a heated humidifier and optional capabilities for negative pressure and positive end expiratory pressure, that is PEEP. And the more effective type of nebulizer is the ultrasonic nebulizer, and this electronic device produces high intensity sound energy well above the audible range. When applied to a water or medication, the ultrasonic energy vibrates the substance with such intensity that a high volume of minute particles is produced. Such equipment usually consists of 2 parts, a generator that produces radio frequency to drive the ultrasonic transducer, and the nebulizer itself, in which the transducer generates the ultrasound energy and applies it to the water or medication. Unlike conventional nebulizer, the ultrasonic unit doesn't depend on the breathing of gas for operation, and thus the therapeutic agent can be administered during the oxygen therapy or a mechanical ventilation procedure. And actually, the respiration is the process of supplying oxygen to and removing carbon dioxide from the tissues. These gases are carried in the blood, oxygen from the lungs to the tissues and carbon dioxide from the tissues to the lungs. The gas exchanges in the lungs are called external respiration, and those in the tissues are called internal respiration. There is a very delicate balance between the absorption and the excretion of oxygen and carbon dioxide in the lungs and tissues, and this balance is maintained by respiratory or breathing activity. When artificial ventilation needs to be maintained for a long time, a ventilator is used. Ventilators are also used during anesthesia and are designed to match human breathing waveform pattern. These are sophisticated equipment with a large number of controls which assist in maintaining proper and regulated breathing activity. For short-term emergency use, these ventilators can also be used. These depend upon the mechanical cycle operation and are generally lightweight and portable. The main function of the respirator is to ventilate the lungs in a manner as close to natural respiration as possible. Since natural inspiration is a result of negative pressure in the pleural cavity generated by the movement of diaphragm, ventilators were initially designed to create the same effect. These ventilators are called negative pressure ventilators. In this design, the flow of air to the lungs is facilitated by generating negative pressure around the patient's thoracic cage, and the negative pressure moves the walls outward and expanding in the intrathoracic volume and dropping the pressure inside the lungs, resulting in a pressure gradient between the atmosphere and the lungs, which causes the flow of atmospheric air into the lungs. The inspiratory and expiratory phases of the respiration are controlled by cycling the pressure inside the body, and however, because of several engineering problems impeding the implementation of the concept and the difficulty of accessing the patient for care and monitoring, negative pressure in ventilators are not become really popular. And positive pressure ventilators generally they generate the inspiratory flow by applying a positive pressure greater than the atmospheric pressure to the airways. So during the inspiration, the inspiratory flow delivery system creates a positive pressure in the patient circuit, and the exhalation control system closes the outlet to the atmosphere. During the expiratory phase, the inspiratory flow delivery system stops the positive pressure at the exhalation system and opens the valve to allow the exhaled air to the atmosphere. Positive pressure ventilators have been found to be quite successful in treating the patient with a wide range of pulmonary disorders. Thank you.